This monthly series aims to address the barrier into entry into research by providing an overview of fundamental research skills and showcasing the diversity of child and adolescent psychiatry research topics as well as research mentors. The series is intended for individuals at all career stages interested in child and adolescent psychiatry research and the incorporation of diversity, equity, and inclusivity principles into their research endeavors. We hope to inspire learners from diverse backgrounds and at all career stages to participate in research, explore ACAP resources, and apply for ACAP research opportunities. Throughout this series, we feature diverse child and adolescent psychiatry researchers who will share the wide array of research topics and career wisdom and introduce foundational research concepts such as how to get started in research, finding a mentor, developing a research idea, finding funding support, presenting and publishing the works, and much more. Each hour-long session will start with a research mentor sharing their career trajectory and using their own research to explain a foundational research concept. They will then close their discussion by sharing 5 overall pearls about engaging in child and adolescent psychiatry research. We will save the last 10 minutes of Q&A. During the session, please feel free to enter questions into the chat, and I will monitor and help share these questions with the audience during the Q&A portion. You may also submit questions anonymously by submitting them directly by direct messages to me. Please note that the session will be recorded. For today's session, we have the honor of learning from Dr. Kevin Simon and Dr. Jack Turban. Dr. Kevin Simon's Boston's first Chief Behavioral Health Officer. Dr. Simon's a polymath, a physician scientist, a healthcare policy expert, an inspirational teacher, and a noted writer. He is an attending pediatric psychiatrist in the Department of Psychiatry and Behavioral Sciences, and an attending addiction medicine specialist in the Division of Addiction Medicine for the Department of Pediatrics at Boston Children's Hospital. He's also an instructor at Harvard Medical School, a Commonwealth Fund Fellow in Health Policy at Harvard University, the medical director of Bayside Youth and Family Support Network, and a healthcare policy and systems consultant. His writings on health equity are in notable journals like the New England Journal of Medicine. Dr. Jack Turban is an assistant professor of child and adolescent psychiatry at the University of California, San Francisco, and affiliate faculty in the Philip R. Lee Institute for Health Policy Studies, where he is the founding director of the Gender Psychiatry Program and researches the mental health of transgender youth with a focus on topics relevant to public policy. He's also a frequent op-ed contributor with work featured in the New York Times, the Washington Post, CNN, the Los Angeles Times, Scientific American, and Vox. He can frequently be found on the media where he discusses issues related to gender and sexuality. We are thrilled to have both Dr. Simon and Dr. Turban with us today. Thank you so much, and I will hand things off to Dr. Simon, then moving to Dr. Turban. Dr. Simon, the floor is yours.
Yeah, so hello to everyone that's here. Lolita, thanks for the introduction. And in real, life, so my kids are with me. They're currently watching Mickey Mouse. My wife is on service. So this is what happens when you're trying to juggle career and life. So I'm going to share my screen here. And no, we're not going to go through every slide. So in terms of my vantage point, we'll talk about safeguarding youth mental health equity in Boston. and we'll talk about some introductions, career trajectory, and how do you kind of marry research policy and clinical together. Um, I'll be mindful to keep this to 20 minutes. Does that sound right, Lolita?
Yes.
Yeah. Okay. Um, and then Jack will come on, or Dr. Turban, and then I think after his
Right.
presentation we'll have questions. So in terms of just background, so my parents are from Haiti. And I think it's important to talk about where we're from. Initially, my mom's from Gonaive. My dad is from a place called Bassembla. Um, Gonaive is actually the epicenter for the enslaved revolution back in 1804. Um, this is a fun fact. Uh, they migrated independently to Brooklyn, New York. So I call Brooklyn home, although now I've lived outside of Brooklyn longer than I've lived in Brooklyn. Um, but this is me, given we're a CAP audience. I don't know, I'm probably, you know, 14, 18, 16 months here. My parents were in front of the same house that they currently live in. Uh, Before me, they did have two other people, my sisters. That's Michelle, to the right of me or the left on your screen, and Tasha, uh, always in the same orientation for photos. They're both in healthcare too. Um, my dad is a deacon, uh, third African American deacon, in the Archdiocese of New York, and was a teacher, social worker currently. My mom is leading. She's awesome. Um, my wife, Dr. Halford, she's actually on service at Beth Israel right now, taking care of hospitalized patients. She says hello. Um, Sometimes we get dressed, often we don't, because these two people, that's Brooke and KJ, that's what they look like right now. Or really right now, they're again eating pizza and watching TV, unfortunately. And so that's my family. I think it's important to highlight where we're from, who we are, because we're I'm a brother, husband, dad, long before doctor, such and such. In terms of career trajectory, so Lydia kind of highlighted this for us, but I'll just kind of walk through. So I went to Morgan State University. It's at HBCU in Baltimore. Um, Subsequently, after that, I migrated to the Midwest to go to SIU. And while I was there, um, between my third and fourth year, well, actually, between my first and second year, I did a summer project at University of Wisconsin in Madison, Wisconsin, um, in surgery of all things. It was first foray into research, and it's actually there that the PI, who you'll see later, Herbert Chen, um, there's a summer program. Um, I was fortunate to get selected there, and it was really him that kind of put the idea in my mind of having research as part of your career, and he noted that what he was doing 20 years, 25 plus years before is not the same thing that he's doing now. And just because I'm in a surgical lab does not mean that I have to do that later. So I come back to um, second year of med school, third year of med school, and we do our, the rotations. I realized I want to go into psychiatry. Um, but I thought the rotation was rather short. And so between my third and fourth year, I took an entire year off to go to University of Pittsburgh because the NIH had a research experience opportunity and figured when else am I going to be able to take time off to kind of just delve into multiple things. And so did some health service research with some people I'll show you later. Um, and for residency, I was at Grady Hospital, associated with Morehouse School of Medicine. And Grady is the fifth largest public hospital in the country. So Grady, the Atlanta VA, fully realizing most of our psychiatric conditions don't begin with people at 45, 55. And so then came up to children's to do child psychiatry. The subpopulation that I work with are those that have substance use disorder. So realized I wanted to do additional training and did an addiction medicine fellowship. And I did that concurrently in the second year of my child fellowship because Children's has a program. And some of the funding that you see here on the left-hand side of your screen, um, leaving residency in third year, I was fortunate to get a NIDA ACAP Resident Research Award looking at substance use. And so I was able to have that award within the first year of fellowship. And I should note during general residency, I'd done American Psychiatric Association or APA fellowship, so public psychiatry fellowship. And then I did a fellowship called GAP, which you can do whether you're a general psychiatry resident or a fellow. And GAP is Group for the Advancement of Psychiatry. So it's like a leadership fellowship within psychiatry specifically. And as I was getting ready to transition to the my second year, I was fortunate to apply for the REACH Fellowship. And REACH is a concurrently supported SAMHSA and American Academy of Addiction Psychiatry that is sponsored or at least housed kind of at Yale. And so I wasn't at Yale, but that's where the main PI was at the time. And so REACH, as you can see, it says recognizing and eliminating disparities in addiction through culturally informed healthcare. And so that was actually some of the funding that supported the addiction medicine fellowship that I had. And as I was transitioning out of fellowships, you see here the Minority Health Policy Fellowship. I actually knew that that's something I wanted to do back when I was in med school, but you can't do the Commonwealth until you're finished your clinical fellowships. And so as a graduating child psychiatry addiction medicine fellow, many academic institutions have these like early career fellowships. And I was in my mind thinking, oh, I'm going to do a 2-year junior faculty award and figure out what else it is that I want to do. But my mentor, Dr. Levy, she had suggested, Kevin, you've already done a couple of 1-year fellowship, and so why don't you apply for a K? And if you're not on mute, you can mute. She said, why don't you apply for a K, of which I had not actually ever considered myself a quote unquote big researcher. And so that was not the intent. Yet in 2020, the application cycle for the K-12 through NIDA and ACAP was cycling. And so it's very niche in that it's looking for child psychiatrists or people who are interested in working with youth, substance use disorder. And so it seemed rather apropos to apply. So I simultaneously applied for the K award and the Commonwealth, not knowing if I'd get either one. And then fortunately, when you apply for a K, you have to write your professional development. And so within that, you can say courses that you would take. So I put like a narrative medicine course at NYU. There's many things that you can describe in addition to the actual research project because the K is about your own professional development. And so I had signaled that doing things in policy is what I wanted to do. And so I was fortunate to be able to secure both awards. And so that was back in 2021. I did the Commonwealth Fund and currently still am a part of the K cohort, although in a subtly different fashion. And like mentioned, I do consult to the DEA, National Basketball Players Association, um, vis-a-vis networks and just networking. So, depending on any given day, I might be one of these things, or these titles, but actually most identify as a learner. I think I know we're supposed to have five pearls to think about. Um, Pearl one, two, three, four, and five for me is keep the frame of a learner, and not expert, although people will call you that. There's always something to learn from a patient, from the world that we're in. And this is kind of like where my questions come from. And so I didn't get here by myself. You got to have mentors or sponsors. It's impossible to really go anywhere without them. It's actually a necessity when you're in research because they're going to ask you, well, who's your mentor? And so these are some of my mentors, and I'm keen to say some. But what you'll see here is a diversity of mentorship. So, I went to an HBCU. Some mentors look like me. I went to the Midwest. It didn't look like me. Atlanta look like me. Boston, some do, some don't. And so it's important to be able and willing to seek out learning from multitude of people, and not everybody that is a mentor or a sponsor of mine agrees with all of my ideas. And sometimes actually the best mentors are the ones that are able to push you to think broader, bigger, than what you're natively coming into with an idea. And I'm going to highlight Lydia Schreier here. She's If you can't see my mouse, she's above the plus between psychiatry and addiction, Lydia. And she was a mentor that was actually on the ACAP NIDA Resident Research Award that I had. And I bring her up, or I profile her, because at the time of the mentorship, I thought she, critiqued my writing to like the nth degree. But then when I switched my own like frame of reference for what was happening in that exchange, she was actually trying to get me to be clearer about the concepts that I was trying to describe. And because of her and my shift of what feedback is, I think I've been able to develop a much more healthier relationship with the feedback process in terms of writing, which makes it easier to then be willing to engage in it, which tends to be something that some people find a challenge. And then here's Kevin, who's the PI of the K that I'm on. And then policy folks. This is Basola Ojukutu in the top right corner. She's the commissioner of health for the city of Boston. And she was actually a Commonwealth Fund Fellow, the same fellowship I did, but back in 2003. And so again, this is just a diversity of mentorship, and it, it's been helpful to me. So I would suspect that it would be helpful to others to be able to have mentors that do and don't look like you, think and don't think like you, in order to expand your perspective. So Mayor Wu, I met her um, 2 years ago. And she basically asked me a question, can I help Boston? To which I responded, do I have to like the Red Sox? Given I'm from New York. If you're not a sports fan, this joke makes no sense. If you are, but it's not a prerequisite to like the Red Sox. But she was really asking me what my perspective is on the state of behavioral health. And fortunately, one of the things that kind of undergirds my thinking around this is the social determinants of behavioral health, or the social determinants of health, really. And all of these factors, ACEs, neighborhood disorder, environmental, poor access to insurance, transportation, food, housing, educational system, underemployment, poverty, right? All of these things are determinants that our patients experience, and depending on where you want to be rather helpful, some patients in some communities experience all of them simultaneously, rather than one at a time. 5 minutes. Lolita's letting me know. Thank you, Lolita. And so, and of note, one of my mentors is Ruth Shim and Michael Compton, who kind of coined the social determinants of mental health. They have a whole book on it. And so when I do my, when I'm engaged clinically, um, and thinking about research, it tends to be in this way. And so when we look at policies and social norms, well, policies are where the policy aspect of my desire to be engaged in public systems comes from. So there have been papers and things that I've written before my current role that signal to individuals that, oh, Kevin's thinking about broader issues in what some might call unique ways. And so, these papers um, are notable for where they are, for what they're looking at. So like this health disparities in opioid involved overdose death is one of the first publications that acknowledged that opioid death was occurring more often in Black population. So in terms of being able to think about a research question, sometimes, at least for me in the public health realm, it's looking at literally the world as I see it and the patients that I'm with. And oftentimes, if you're keenly observing or keenly listening to what your patients are telling you, there's usually like a question there, and that question can then propagate something to investigate. So in terms of the public policy part of my world, the city secured ARPA funding, and you can see that the ARPA funding was split into many different fractions, and some of it went to behavioral health. And so they wanted somebody that thought about public health, but specifically mental health and behavioral health in a particular kind of way. And so that's where I come in. We have a team. And so Vasola is who I report to, given she's the commissioner or the executive director for the Boston Public Health Commission. And the center is really these four people. And what do we do? We're like a think tank slash do tank. I recognize we're running out of time. But we help the broader commission and the large departments of the city, Boston Public Schools, Boston Police Department, think about behavioral health. And then we're responsible for the allocation of resources in what we would call RFPs. So we would put proposals out and we seek institutions, organizations, nonprofits to apply for funding. And so I'm gonna skip ahead. So for instance, increasing behavioral health workforce was one of the things that we identified in a community health needs assessment. And so how do we do that? We create this RFP, Behavioral Health Workforce Pathway. And top right, increase, promote diversity, address workforce shortages, help Boston. Those were the demands that we had. Here's the kind of outlines that we're looking for: inputs, activities, midterm outcomes, long-term outcomes, impact. And then organizations submitted proposals, a committee selects. And so I'm going to streamline this. This is how you can, in one facet, intertwine activities related to DEI from a policy perspective that then actually does have downstream effects of actually helping individual people, individual patients. And because I'm nearing time, I'm going to stop rather than keep going. And so I'm going to stop sharing.